Okay, let's get started. Good morning, everybody. For those of you who have not been on our calls, I'm Christine Jacobs. I'm the Executive Director of Represent PA. Represent is a PAC. Our role in helping to elect women in this state is to even the playing field in terms of the money that they get. So we're early sponsors of money to women candidates who want to go to Harrisburg, support all of us, and really make a difference in how Pennsylvania is run. In honor of Women's History Month this month, we've focused on our last one, featured 3 of our women representatives who are all people that Represent has supported, and they talked about equal pay, and they talked about what's going on in terms of getting legislation so that women and people of color are all paid equally to their colleagues. And that briefing is available on our website and our YouTube channel if you want to watch it, because I think it was a fascinating conversation between our 3 state representatives. Today, we decided to focus on an issue that's core to Represent. When we talk about who we endorse and how we endorse people and how we endorse women, we ask them about their values in a questionnaire. And one of the things that's very important to us is women's health and how they view women's opportunity for choice and making decisions about their own bodies. And that really expands also when you look at women's health to make sure that there is equal opportunity for good health care in the state of Pennsylvania. So that's why we decided to focus on women's health as our closing event for Women's History Month today. And we're so pleased to have State Representative Morgan Cephas, and Morgan is the vice chair of the Women's Health Caucus in Harrisburg, and she sits on the health committee. And if you heard us a couple minutes ago, Morgan is also on the appropriations committee. And she's a outspoken person to talk about what's going on women's health. And every time she talks about what's going on in maternal mortality, I get more inspired about her work. We also today decided to balance Morgan with a physician, and Dr. Honebrink is an OB-GYN with Penn Medicine, and she's the medical director for Penn Health for Women at Radnor, and which looks at a full multidisciplinary approach to women's health care across the ages. So they'll be speaking with you. Why does Represent support Democratic women? Because they needed the extra help. And PA is one of 5 states, I've showed this slide before, one of only 5 states in the country that's never had a woman governor or senator. We ranked 31st in terms of the number of percentage women in our state legislature. We have 14 women in the Senate and 59 in the House. The good news is we're up from 40th in the United States in that category from 2016, but all of that change was made in 2018. And in 2020, we really had no change in terms of our overall ranking. Just for your education, there are 142 women in both chambers of the US Congress, and that's out of 535. And again, I always like to remind you, if you're not at the table and you're not one of the decision makers, then you're on the menu. One of the worst slides I saw in recent years was about 5 years ago that showed a group of white men in Harrisburg discussing abortion. What's wrong with this picture? Never is this issue more important than on the issue of health. Never has it been more important that we have women on the agenda and women making part of the discussion. What we want 12 months of postpartum Medicaid coverage. We want expansive contraceptive coverage. We want all kinds of things that will make women's lives better. And what do we get from this group in Harrisburg? We get heartbeat bills and more constraints on choice. We get controls on what an abortion facility is, unreasonable controls that surpass what they have for other medical facilities. And we have very few hearings on health discrepancies because the agenda is set totally by the majority, and women and Democratic women are in the minority. Okay, so that's it. So what I'm very thrilled to be able to do to present to you first is Morgan Cephas, who we have endorsed Morgan throughout her cycle of being in Harrisburg, and she's a strong advocate for all of us, and all of you should know her better. So Morgan.
Thank you so much for inviting me to close out this Women's History Month. As you've stated beautifully, as the co-chair of the Women's Health Caucus, we've really set a bold agenda for this legislative season. And, I'll touch on that a little bit more as we move through the slide presentation. But to your point, my first time joining the health committee. So, I'm imagining me as, a new health committee member coming on excited to talk about, maternal mortality, dignity for incarcerated women, expanding Medicaid and things of that nature. And, to your earlier point, we get hit with, limiting access to reproductive care instead. So much so that we will be spending an entire hearing next Thursday on limiting access to abortions, talking about, again, the heartbeat bill, the 6-week ban, as well as fetal burial remains and things of that nature. And the most troubling aspect of that is that we're going through a pandemic, and these are the issues that our committee chair is deciding to talk about. One of the things I, really just wanted to highlight this morning is that the health and wellness of women have, really come to the forefront during COVID-19. Not that we haven't been championing these issues for some time, and not that Represent PA hasn't been championing these issues, but, COVID-19 really just exacerbated, the circumstances that we are all in. When we review statistics, we know that women are contracting the virus at a higher rate. They are dying also at a higher rate than our male counterparts. And, that's really due to a laundry list of reasons. Women are frontline workers, as we know. They are our store clerks. They are our home health aides. They are our nurses. They are our teachers. And we also know that pregnant women were left out of clinical trials. So they have been disproportionately impacted, but also we're beginning to see this as a form of discrimination when it comes to, accessing care and, ensuring that pregnant birthing people are part of the conversation during COVID. We also recognize that just recently, there's been, just so many reports recently released during this pandemic. And the National Women's Law Project just recently released a report stating that close to 2.2 million women have left the workforce during the COVID-19 period. And, when we think of women leaving the workforce, we think of women, not having readily access to healthcare because, again, it costs. But then also the impact to our economy is going to be detrimental. When we think about women coming back into the workforce, that's women starting, from the ground up again, losing seniority, losing salary and things of that nature. So when we think of women's health, we also have to not just think of it from a health lens, but we also have to think about it from an economic lens. We have to really ensure that as we're moving forward through COVID-19, that we are really taking these issues into consideration. So I am happy to, be able to talk about this topic, especially with a doctor that is also on the front lines of this battle with us. We, make it a point to listen to advocacy groups like ACOG as well as Represent PA to, give us our marching orders up in Harrisburg. So again, I thank you for allowing me to be a part of the conversation this morning. So before we dig deep into some of the work that we're doing up in Harrisburg, I really wanted to talk about health equity. Again, as we look at women's health, we not only have to look at it from a lens of an individual's ability to access a hospital bed, but we also have to look at the entire person and what goes into impacting one's health. And I really like this slide because it really shows all of the other aspects of an individual's life that determines their health outcomes. So when you look to the left in this infographic, you see literally 20% of an individual's health outcomes is determined by their access to healthcare. Again, that's access to affordability, access to quality, also access to an actual bed. I mean, I live in a district where I don't have access to, or my constituents don't have access to an immediate hospital. The closest one is roughly 10 minutes away. And again, this is in an urban setting with with 6 amazing hospitals still existing here in Philadelphia. But when you think of our suburban counties, when you think of our rural counties that don't necessarily have access to healthcare systems, and when you have this added pressure of a pandemic, you just think of how individuals are limited to their ability to live, a quality life. And that is really what health equity is. And again, the healthcare aspect is only 20% of that. When you think of the social economic factors, that is 40% that contributes to your ability to, live a healthy life. That is, and when we're talking about social economics, we're talking about, access to, education. We talk about access to job opportunities, access to a quality wage. So when we're talking about all of the issues up in Harrisburg, again, about increasing the minimum wage, increasing access to quality childcare, all of this fits in the ability for an individual, particularly women, because we all know that women are the majority of heads of households. That means they are the ones representing the income in their households. And when they don't have access to social economic opportunities, it inevitably will impact their health. But we also know 10% of an individual's physical environment contributes to their health equity. When we're talking about issues like Marcellus Shell, the impact that it has in the southeastern region of Pennsylvania, that really contributes again to the quality of air, the quality of water. I know my colleague Daniel Friel-Otten oftentimes loves to take us to our district so we can get a real live experience on what the downstream impacts are of Marcellus Shell. So issues like that we're talking about contribute to an individual's health equity. And last but not least, 30% deals with health behaviors. So your recreational activities, smoking, drinking, your sexual activity, all of those things contribute into, again, your ability to, live a healthy life. So when we're talking about contraceptive access, when we're talking about reproductive health care for women and, femme identifying individuals, we're talking about, someone's ability to, again, live a healthy life. And again, COVID-19 has really shone a light on so many of these issues. And, oftentimes we don't equate all of these conversations with a woman's ability to live a healthy life. So again, when we talk about health equity, we have to talk about the entire person as well as, the entire environment that they are impacted on by day by day. So with that, again, this is given us an opportunity to really set a bold agenda for the Women's Health Caucus. As was mentioned, I am a co-chair of the caucus with State Representative Mary Jo Daly, Senator Amanda Capoletti, as well as Senator Judy Swank. I think you might know them. I feel like you've supported them just as much as you supported me. Again, we as a newer member that sits on the health committee, the fact that we are talking about limiting access to reproductive care when we have so many other issues that are on our plate is astounding. And I think, next week we will have an opportunity to, ask those hard questions. Just recently, and I know my co-panelists will speak a little bit more about this, but recently the Commonwealth of Pennsylvania, as well as Philadelphia, released a report in reference to our maternal mortality rates. And we are increasing during between 2013 and 2018, we've seen a 21% increase in maternal mortality deaths here in the Commonwealth of Pennsylvania. And again, this was pre-pandemic. When you add a pandemic into the equation, think of, the increased isolation, God forbid, our mothers and birthing individuals navigating our vaccine and testing operation. I honestly believe we are going through a real life example of Hunger Games with this system. But then also thinking about having to create a new birthing strategy as a result of this pandemic. So when we think about what our women's health outcome numbers are going to look like post this pandemic, we're really going to be in an interesting time. But I do truly believe with as many dollars that are coming from the federal government, we will be able to have an opportunity to build a better foundation for women in the Commonwealth of Pennsylvania. But we have to do it strategically. We have to be very intentional about the decisions that we will be making over the next several months. So this takes me to, our agenda as a health caucus. First and foremost, again, we will be focusing on maternal health and childcare. We are getting billions of dollars of an investment from the federal government as it relates to childcare. Because as we know, this has been one of the added pressures for women in the workplace, not being able to access quality childcare. We've seen a significant rise in closures in childcare centers. We've also seen some closures due to, again, the impact of COVID-19. So we really have to ensure that we are protecting this infrastructure, because you can only imagine if you're juggling your work schedule, but also juggling a 2-year-old is extremely difficult. So some of the issues that, again, we will be focusing on will, of course, be maternal mortality, maternal health care, workforce expansion, ensuring that we're expanding the continuum of individuals that work in maternal health. So that is, doulas, that is, midwives, that is community healthcare workers and things of that nature, but also talking about postpartum coverage and, again, affordable childcare. When we're talking about postpartum coverage, a majority of the deaths when it comes to maternal mortality happen during the postpartum period. In Pennsylvania, roughly 51% of our deaths occurred during that period. Another issue that we will be touching on is workplace and economic justice. This is, really a passionate area for my colleague, Representative Mary Jo Daley, and with her workplace accommodations bill, and ensuring that mothers and birthing people are able to return back to work without being isolated, without having the accommodations that they need to, again, be healthy. Additionally, sexual harassment and discrimination. As we know, this was a hot topic. We're like aging in dog years. I feel like it was about 2 years ago, but I know it's just moving so quickly. But sexual harassment and discrimination is still a hot topic that we will, hopefully see some movement on this session. Equal pay, fair wages, and paid leave. I mean, one of the things that we are constantly reminded of in COVID-19 is that our frontline workers who are not getting paid an equitable wage are saving lives to this day and keeping us healthy and maintaining our access to grocery stores and things of that nature. The other piece is dignity for incarcerated women. We also have to, be sure that we're paying attention to our most vulnerable. And we all know that women are the fastest increasing population in our prison system. They are going in with being, again, heads of households, a significant percentage with mental health challenges, a significant percentage experiencing sexual assault at some point in their lives. So we'll be touching on, access to feminine hygiene products, as well as strengthening our shackling laws for pregnant and postpartum individuals, but then also ensuring that we have trauma-informed training for staff. So these are some of the issues that we will be trying to tackle within, our prison system. Last but not least is healthcare. I mean, this has been, a year for all of us when we recognize again how COVID-19 just not only exacerbated our systems, but showed a lot of the cracks within our healthcare system. So some of the areas that we will be focusing on is the expanded reproductive healthcare access and coverage, clinical practice, patient autonomy, menstrual equity, access to telehealth. So we have a bold agenda and a laundry list of things that we will be trying to tackle as it relates to women's health. It is going to definitely take some arm twisting, and hopefully we'll be able to get something more accomplished than just conversations about limiting reproductive care. So that is our agenda. And again, I'm happy to be having this conversation with this group this morning. And I'm going to, with that, turn it over to Anne, who's going to take a deeper dive into some of the topics that have been elevated recently, not just during COVID, but several months prior to COVID. So topics that have been at the top of the media, top of policy minds, and that we're actually seeing some traction on the federal level and on the state level. So with that, I'll turn it over to Anne.
So there are certain legislative things that we've learned from some of the foundation we built on that we're looking for. And one thing we'll be talking more about is the extension to 1 year postpartum for Medicaid. I don't know whether you all realize this, but if you're on medical assistance, you can get on medical assistance more easily when you're pregnant. But once you're 6 weeks postpartum, that goes away. And as we'll talk about in a minute, that's a risky time. We already touched on it a little bit, but it is a risky time for women when we look at maternal mortality. Expanding coverage for support people and doulas in labor and afterwards, and certainly midwife licensing is something that ACOG works with our midwife colleagues on a very long-term basis. Expanding postpartum screening and support and the implicit bias training. I know I am lucky enough to be at Penn, and I thought I was a pretty with it person, but our implicit bias training has taught me so much over the last few months that I really hope that it's able to be expanded to all of us who work in healthcare and probably all of us who live in this world. But covering fertility treatments is something that is traditionally not covered by medical assistance, and is something that is very difficult to navigate if you are on medical assistance. And obviously, parental involvement leave is something that certainly helps our kids get off to a much better start. And I couldn't, when ACOG took up the shackling of incarcerated people, like a long time. I've been working with ACOG on advocacy for a long time. I couldn't believe it actually happened, but it does, and it's not something that anybody in the OB-GYN world wants to have happen. It's unbelievable. So maternal mortality is one of the main things that has been really resurging in the last 10, 15 years. When I first started working with ACOG a gajillion years ago, Pennsylvania, New Jersey, and Delaware are grouped together in a district in ACOG, and I represent Pennsylvania, and New Jersey had robust maternal mortality review forever and ever and ever, and Pennsylvania and Delaware just had stopped doing it. It is something that was very prominent in the early 19th century, and really not because of review did we get from 600 to 900 deaths per 100,000 births, but the review showed that the death rate, maternal mortality rate, decreased a lot in those 20 years after 1930 for a variety of reasons. But review helped identify what went wrong and help promote the things that you can do to fix it. And we really thought, problem solved around 1980 or so, and all the reviews stopped. And then we realized, well, the United States is not doing so well compared to other developed nations. We maybe want to start paying attention to this again. And Pennsylvania finally got on board. We were not the last state, but we were close to the last state to have statewide review. We've been doing review in Philadelphia for the last 11 years, but we have 22 deaths per 100,000 in the United States, which is more than there should be. And the important thing when you talk about maternal mortality, I don't want to get into the weeds in this too much, but there's a pregnancy-related births, which means this happened, the pregnancy either exacerbated or caused the condition that made the person die, and pregnancy-associated births. So the pregnancy-associated births, if you look at pregnancy-related and pregnancy-associated, the number is going to be higher because pregnancy-associated births takes every woman who is either pregnant or in the first year postpartum who dies and counts her. But as you can see, the deaths are, the majority of deaths occur in the postpartum time period, which is one of the reasons we're pushing for extended coverage for women after they have their babies. And again, non-Hispanic Blacks are way overrepresented in the death rate. In the state of Pennsylvania, Medicaid pregnancy-associated deaths that we have payment information, which can be, I mean, the whole maternal mortality review is fascinating. It's not a topic for today, but it's really a really amazing process. But when we have information, 53% are paid by Medicaid in the state of Pennsylvania. It's different. It's a little different in Philadelphia, but that's about the same proportion of births that are covered by Medicaid. People not getting adequate prenatal care does seem to make a difference when it comes to maternal deaths. COVID-19, I think it's too soon to say how many maternal deaths we're going to see from COVID-19. I know we are seeing, but directly related to having the COVID virus, you're more at risk for having a complicated course with COVID-19 if you're pregnant, but not as bad as some other conditions like being older. We have had, I know at Penn, several women who have had prolonged time on ventilators, both later in pregnancy, delivered while they're on a ventilator, and then gotten to meet their babies when they got off the ventilator. But there's also the impact on prenatal care, which interestingly enough has not always been bad. You know, expanding telehealth, saying you don't have to, I don't know, probably a lot of you have babies and had to show up and sit in the OB waiting room for a million years before you had your 3-second visit. And I think that we've always known we could probably do better with that. And maybe we didn't actually need you to be face-to-face as often, but I think we've really streamlined the telemedicine piece of prenatal care. It's still important to touch base. It's still important to talk about how the pregnancy is going and to look at blood pressure and weight gain and things like that. But you don't necessarily need to have that in-person visit. And I think we've learned a lot about how to do that. Penn has been really inventive, even before this, in tools to help follow women more closely that don't involve coming into the office. Everybody gets a blood pressure cuff who's pregnant, so they can take their blood pressure before and after. You get a reminder to take your blood pressure if your blood pressure is high. Their texting has really been a boon to that type of healthcare at Penn, and we've really seen it not just at Penn, but Penn, I have to put a plug in. It's not my department, but they were really pioneers in this, and it's really making an impact on postpartum issues, especially with hypertension. We've had Philadelphia maternal mortality review for longer than in the whole state, and I can speak a little more about what we've learned. There were 110 deaths that we reviewed from 2013 to 2018. And remember that pregnancy related, most of them were not pregnancy related. Most of them were not because the person was pregnant, the problem was exacerbated by pregnancy, but 26 were and 84 were pregnancy associated. 72% were in the postpartum period. Again, this is why we're really pushing, let's get that coverage expanded after that 6-week postpartum period. And in the pregnancy-associated births, we are seeing a rise, as we are in everywhere else, in mortality from drug overdoses. And that has really shot up in the 2017-2018 review. And unfortunately, that trend is continuing in the 2019-2020 review. This is just, so that's maternal mortality, and it's the lessons we've learned from it that are driving a lot of what ACOG, especially in Pennsylvania, is putting forward in their legislative agenda. This is something we've had on the agenda for a way longer time, and it's a bill that is currently in the Senate, but this is like an example of how legislation can help us improve healthcare. And this would allow, if someone comes and sees me and they have gonorrhea or chlamydia, a very important part of treating them is treating all their partners. But I can't do that because their partners are not my patients. But this would allow me to say, okay, here's a prescription for your partner or partners. If you don't think they're going to go to the doctors, here's a prescription for them. Make sure they're not allergic to this. And then it would be codified that I could treat the partners of women that I diagnose with sexually transmitted infections, and vice versa. For the if someone diagnoses it in a man, they could also treat the female partner, which is way better than not getting treated. If we can, treat partners, we really decrease the incidence of sexually transmitted infections, which are not have a lot of downstream complications. Contraceptive coverage, as Morgan said, is really important. Some of you, I can see some faces where you remember the time when you had to say, I'm having heavy periods, I have bad cramps, to get your pills covered, because birth control pills just weren't covered by insurance. It was like outside the prescription coverage. Pills have been covered for a while, but the Affordable Care Act made all FDA approved forms of birth control covered, which is, we now have several wonderful, reversible, easy to use options that are expensive because they're 5-year, 10-year options, but they were excluded from coverage until the Affordable Care Act came into being. And as long as you don't work for Hobby Lobby or the Catholic Church, you're going to be covered. And also, one of the things that sometimes it just amazes me, the things that are like, what were we thinking? That you weren't allowed, you were not covered for a Depo-Provera shot or an implant insertion or an IUD as long as you were in the hospital after you had a baby. You had to go home, come back, and get it done. And like it was going to be covered, but there's just this barrier. And part of the maternal mortality review made us realize she probably wouldn't be someone we're talking about today if she didn't get pregnant. And it's someone who didn't get to that opportunity to have the long-acting reversible contraception placed after they had their baby. So we really pushed, can't we change this? Can't we get the regulations changed? And we did. So now in Pennsylvania, you can have coverage for reversal, to get your IUD or your Nexplanon or your Depo shot before you leave the hospital. Then the last thing is, as Morgan touched on, the laws that are shrouded in let's make women's health better, that are really not for that at all. They're for limiting access to choice and limiting the ability of a woman to have control of her destiny. So, keeping contraceptive coverage available, accessible to everybody is, I think, a high priority. It would be great if we could have a world where no one ever needed to make that choice about an unintended pregnancy. But even if we have perfect access, we're not perfect people, and it's not going to be perfect, but it would be less. So having the options available or something, we always work hard on at ACOG. And we work on training people so that they're able to place those options when that's what their patients want. And then supporting women who choose to continue an unintended pregnancy. Part of the reason women often will choose to terminate a pregnancy is because they don't have any support. They really aren't able to have the means to care for the kids they have, and for another child, it's just not something that they can see themselves doing. So supporting those women who choose to continue and keeping abortion safe and legal and accessible for women who choose not to continue an unintended pregnancy is also important. One of the things, just as an example of the barriers that come up, I don't know whether medical termination of pregnancy is something that can be done early in pregnancy. You have to figure out you want to terminate the pregnancy early, but you can basically take medicine and cause an abortion. But the laws are such that you have to have a face-to-face encounter with a provider before, face-to-face in the same place, before you get the medicine. And in COVID times, people wanted to be able to say, can't we do this via telemedicine? And a lot of regulations were barriers put where, no, you have to be face to face. And when, you're not just a million miles from a provider, but when you have to, there's not access to care because we're in the middle of a pandemic, that just didn't really help anybody. So again, thank you, Morgan, for your work to call out those things. And I really hope we can put more people like Morgan in place who can keep our conscience in the right place. And that's, I think, all I have. But do we have questions, or?
We do have time for questions. And I first want to thank both of our speakers. Anne came to us through, when we decided to do something on women's health, Morgan was an easy person to contact because we're all aware of her work. I also want to thank Dr. Val Arkush. Val is chair of the Montgomery County Board of Commissioners. But Val is also, first of all, she's a long-term, she was one of our first supporters of Represent 6-8 years ago when we started. But also Val is by profession an OB-GYN anesthesiologist. So Val was very aware of a lot of these efforts through her work in medicine. It got her to a lot of work that she did on the Affordable Care Act after she got her public health degree, and she introduced us to Anne, who's one of her colleagues. So,
yeah, I still miss Val. She was, I've known her for a very long time. She was an excellent anesthesiologist.
And Val was on at the beginning of this call, but her real job, her day job intervened and she had to cut off. I also I've got a couple questions. Morgan, and then if anybody else has a question, please send it to us through the chat. Morgan, we have a Republican majority in the legislature, as we all know, and they set the agenda. But they claim to be pro-life, but a lot of the issues you talked about have to do with the life of the mother. And this whole discussion, I was aware of a lot of Mary Jo Daley's work on what happens to support of nursing mothers, for example. I had 2 of my children were born while I was an executive in companies in Pennsylvania, and I pumped breast milk in the stall in the ladies' room. So I know how degrading that whole process is. But I was completely ignorant to the issues that affect postpartum women. And why is are you having difficulty having your colleagues talk about these issues in their pro-life agenda?
Absolutely. And, excuse the background noise. There's an 8-month-old upstairs and I have a so best co-workers. Yes, believe it or not. Well, of course we believe it. When they talk about being so pro-life, when they talk about pro-life, when they talk about maternal health, women's health, they only equate that to limiting access to abortion. They're not having a conversation about the lack of perinatal care, which we saw in the Maternal Mortality Review report that a significant number of deaths, the individual did not have adequate access to prenatal care. But then also, again, to Anne's point, who talked about it, is during the postpartum period, we're losing a lot of our women. And just in the year of 2018, 40% of the deaths were due to accidental poisoning, which also is an example of drug overdoses. So the fact that we are not protecting the mother throughout the entire 4 trimesters, and we're only focusing on that one moment in time, that one decision, is extremely heartbreaking. And that is what they have been focusing. The fact that we have a health committee during a pandemic, and the very first hearing that we're having is about limiting access to reproductive care. That shows what their priorities are. And again, with the Health Caucus, Women's Health Caucus, as well as with our chair, Dan Frankel, we put out a press release. We've been writing op-eds. We've been, shouting to the world. We have so many other issues to tackle as it relates to women's health. Those are the things that we need to be prioritizing. Yes, for some reason, I feel like we have more women on the Republican side, and they're just now coming around to even having the conversation about postpartum care and postpartum depression and things of that nature. But, it's great to introduce bills. It's great to, talk about these issues. Now we want to see if they actually have the guts to confront their male counterparts to move the needle on women's health issues.
Wow. I learn, I hope you're all listening to all that. I learn a lot by listening to our guests on these calls. And I'm going to be fascinated to watch, Morgan, what happens with your Republican women colleagues and whether they're willing to push ahead on these issues. Because the leadership may not be, but what are they going to do? I hope you'll keep us informed. And we plan to send out, we'll send out announcements to everybody on our mailing list, keeping you informed, because major issue.
Yeah.
Oh, we had a question from Nancy Bernstein, who's in Allegheny County, who's one of our supporters. But the same issue holds true throughout, odd number years or often years in Pennsylvania, where we have elections at the local level. Do we have any feel for what happens in local city offices, county offices, that, both Pittsburgh and Philadelphia? Pittsburgh has a race for mayor coming up. What's possible to do in local health commissions?
I think there's a lot possible, and and I don't want to suck up the time. So if you
and Anne, you can comment on the work that you've done and how ACOG, by the way, I assume is the American College of Gynecologists.
Of obstetricians and gynecologists. Yeah, I should have said that. I apologize.
No, that's okay. I assume that. I just wanted to make sure I got that out. But I want you to answer this one on what you're doing on the local level also.
Well, I think that part of the way that maternal mortality review came to be in the city of Philadelphia was because of the Philadelphia Maternal and Child Health Department. That's where it started. It, interestingly enough, then was run out of the coroner's office, where there's this lovely gentleman pediatrician who does all kinds of death reviews. He's his last name is escaping me at this moment, but he's a lovely, lovely man who talks about death all day long. So that type of, now there's federal impetus to have maternal mortality review, but there wasn't then, and to get it in place really took a local effort. There's a lot of things that the health department is working with, and I don't know whether you all realize this, but in the city of Philadelphia, there are just 6 places where you can have a baby, 6 hospitals, which has good and bad points. But the good point is they can all meet together and they can all talk to the health department, and we can work. I'm not sure we've totally accomplished this yet, but having a shared record that if you go for prenatal care at, say, Jefferson, but you end up at Penn, we can see the prenatal records, which is huge. That sharing of information between the places someone might have a baby really is huge. So there's a lot that happens on the local level, and where we interact with the health department, and some of our members work for the health department, which is really wonderful. The woman who's taking over maternal mortality review is very active in ACOG as well. But on the city level, the woman who's taking over maternal mortality review. So there is a lot, and I honestly don't know that I've ever felt like the mayor was a big part of anything, but but it always helps to have someone who's on your side.
I hope Pittsburgh has better luck with their mayor on being active than Philadelphia does. Let's just leave it at that. There was a question about.
I'll just add to that Morgan, quickly. I mean, Anne is, exactly right. It really took to really address maternal mortality issues in Philadelphia. It took the cooperation of these 6 hospitals to understand that they, had an issue, they had a challenge, but also as the experts, what they needed to do in order to move the needle in the right direction. And not only are they, having this data agreement, but, we're always talking about understanding, racial equity as it relates to this issue. And, these birthing hospitals now are doing trainings with their incoming students on racial disparities and things of that nature. So they're using it as an education tool, and then, dealing with the issue of implicit biases in the healthcare system. So you can do a lot when you have, not that our mayor doesn't understand. I know that is a separate topic, but we have had the opportunity to have a conversation with him about maternal mortality, what it means, understanding that, it doesn't matter your education level or your economic level, Black and brown women are still impacted at a higher rate. But out in Pittsburgh, when you talk about there being a mayoral election, and I want to say it was a 2017 report, an equity report that, pretty much stated Black and brown women are at an extreme disadvantage when it comes to, access to women's health care. So as a mayor, you have the ability, like Philadelphia, to establish your own review committee. So you can study what are the challenges in your area. But then also you have the opportunity to bring together those hospital systems, like Ann talked about, to come up with real solutions. So local elections really, do matter on, the outcomes of women's health. So I just wanted to add that.
Thank you.
Yeah.
And how do we help the women who are not in Pittsburgh or Philadelphia? Pennsylvania is a very broad and very diverse state. One of the things we've talked about often in these calls is how all the holes in our society have been laid bare by the pandemic. The lack of, you talk about telehealth, where there's large parts of the state where we don't have broadband, for example, and people don't have access from home to be able to have these kind of services. What are you looking at? How do we, Ann, have you seen statistics on what's happening outside the major urban centers and the suburban counties in terms of access to hospitals? And Morgan, is anything being looked at in terms of how do we support women who are outside the urban areas of Pennsylvania?
Well, you're asking a good question. I know that we have looked at
questions. I'm really good with questions. I
know that ACOG has looked at access to obstetric care, and especially, this is not a real recent thing, but a lot of places, because of issues with liability costs, said we're just not going to deliver babies anymore. So in the late 90s, around that time is when, that's a big part of the reason that the number of delivery hospitals in Philadelphia lessened, and it happened across the state. So I honestly, you're asking a good question. I don't feel like that's been a major topic for us recently. But it is across the country. It's one of the reasons that ACOG has a task force on telehealth, because of access for people in rural areas where there's just not going to be a hospital nearby. Trying to have consultative services with maternal fetal medicine specialists and other specialists that can be done via telehealth, because there's just not the volume to support somebody being there all the time. So I know that while telehealth the access may be limited in rural areas, it's not as limited as the access is sometimes to hospitals. I know that didn't probably really answer your question. The other thing I'd like to add with maternal mortality review, it's not just bringing the hospitals together. That is really important, but it's also the fire department. We had a couple deaths, one review period, they were, it's heartbreaking to review these deaths, but from fires. And let's work harder to have smoke. They were all houses that, guess what, didn't have smoke alarms. And I didn't realize that when you gave out smoke alarms, a lot of people take out the batteries. I would do this to power something else. And like, how can you try to make that not happen so the smoke alarm works? And just, home health care, there's a lot of stakeholders at the table, and it really is a wonderful multidisciplinary thing where really people get it, and we really can come up with good concrete recommendations for this might be something we could do to help things.
That's great. Morgan, is there any emphasis, on the rural health?
Oh yeah, absolutely. Believe it or not, our health committee chair on the Republican side put in a telemedicine. Who
is that, by the way? Let's name names. Who is that?
Okay, I didn't know you wanted to do that.
No, you can just talk about his title.
So Chairwoman Kathy Rapp on the Republican side, who is the one that is constantly bringing up limited abortion access bills throughout, her entire career. We literally had a telemedicine bill on the table that Republicans and Democrats, were able to get behind to provide, reimbursements at, an equitable rate when it came to telemedicine. And she literally put in the bill trying to limit access to abortion care. And it torpedoed the entire bill. They refused to bring it to the floor because, some people just weren't willing at the time to vote on the issue of abortion. And on the flip side, she also talks about limiting access to healthcare in rural areas because she represents a rural area. So when you think of COVID-19, urban settings in the Southeast, we have hospital systems, we have access to care, but it's the rural areas that are really impacted and taking a dive when it comes to not having access to healthcare. So telemedicine is, a core and a key component that we are going to need to invest in. And when you have state reps like Pam Snyder, who was constantly talking about, the lack of access to broadband and, not being able to, and it just doesn't just come to healthcare. When we think of our education system, when you think of, school districts having to build an entire digital infrastructure to support our young people, it, again, in the Southeast, we have, philanthropy, we have universities that, have helped us get through this time period. But when you think of rural areas that just don't have access to that type of capital, those type of partnerships, they are really being hit the hardest. And I think what COVID-19 has done, it really has created a level playing field for those in suburban areas, again, that don't have hospital systems, to urban cities that have had, I know we have 6 birthing hospitals currently, but that's down from like 15 over the past 10, 20 years. But then again, you think of our rural areas who, just don't have the footprint that we have. So telemedicine becomes, key. And I know Ann talked about it briefly. When we get out of COVID-19, there's some things that we need to invest in, and that is more in telehealth. When it comes to, the innovation that University of Penn has around the issue of maternal health, we have to figure out a way to invest in that with all of the dollars coming from the federal level. How do we invest, but also how do we expand that footprint? So again, we can keep communities healthy. But again, COVID-19 has really, not that it's awakening us, it's really has woken those in rural areas that if they don't address the issues and the challenges that really exist, then they're going to be left behind, unlike other cities. So there is to answer your question, there is a significant focus on what's happening in rural areas because again, they're getting hit the hardest. And the best way for us to help move the needle in that way is to elect more Democratic women in those areas.
Well, what a commercial for Represent we end up with there. I always like to hear those. And I just want to close, first of all, by thanking both of you, but also asking if either of you have some words on, you've got over 50 activists on this call. You've got 50 women who are, and some men who are asking in the chat, what can I do to help you? What do you want in terms of, yes, we know that our mission, and we'll close with our mission about raising money to support pro-choice Democratic women, but what do you want them to do? What do you want them, how do they get involved in the hearings? Who should they be writing letters to? How should they be, by the way, if any of you on the call are represented by Republicans, what you need to be doing is calling them a lot. But Ann, Morgan, what do you want this group of activists to do next?
Well, I'm going to let Morgan finish it up because she's going to be much smarter than I am. But I think just pay attention. And if you can go to those, I don't know whether those hearings are going to be open, but it would be an amazing thing to organize a big group to come to those hearings if we could. And you can address that. But pay attention and call it out. I think that the shame that is sometimes associated with being a pro-choice person. First of all, we have to do better with our terminology. Coming up with pro-life was, I'm sorry, a brilliant move.
Brilliant. It was a brilliant tactic.
And we need to keep calling it anti-choice.
Right.
The words that we use really do matter. And And, you know, if you see something where you hear that some employer is not going to cover contraception because the corporation's views are more important than the individual woman's, we need to call that out and say, maybe I won't go to Hobby Lobby, or, you know.
Yeah, well, they're on my list. You know, this week, Delta Airlines, Home Depot, and Coca-Cola went on my list, but Hobby Lobby's long been there, not to get my own.
Yeah.
Morgan, close us up. What do you want to, you know, I've got a few slides at the end of this, but Morgan, what do you want this group to do for you? How do we help you?
I think first and foremost, again, giving you another plug, invest in organizations like Represent PA, and as well as, you know, organizations like ACOG that Ann is a part of. You know, you got to get involved. I mean, right now, more than ever, you know, it is going to take so many of our voices to move the needle on all the issues that we care about, and be very vocal that, you know, women's health is more than abortion care. It is, you know, access to childcare. I mean, we talked about it, you know, throughout this conversation. And, you know, it's important for us as women to, you know, elevate that conversation. So, you know, at the table that you sit at, you know, how can you advocate more for, you know, not just women's health, but women during this critical time? I mean, I mentioned 2.2 million women left the workforce, and, you know, we really need to understand what that means, how much that is going to set us back. But also, again, I look at every crisis as an opportunity. Is how can we, to take a line from Joe Biden, how can we build back better? And, you know, every single person on this line has a role in that conversation, whether, you know, you're sitting on a board, whether, you know, you're in the C-suite, whether, you know, you're at your job or a part of any organizations. Make sure that you're elevating women's issues at every point that you can, at every opportunity that you have, whether that, again, being op-eds or participating in hearings, testifying at hearings, or just coming to participate. So, you know, we have this hearing coming up again next week all day, where we're asking advocates that, you know, are, you know, just pro women's health to come sit with us in the hearing, as I'm sure they're going to have, you know, pro-life individuals, you know, come up and be our champion.
Anti-choice.
There you go. I got to work on it.
And are those open? Are there Zooms so we could log into those hearings?
Absolutely. You can come in person, but know that, you know, Republicans still don't believe that COVID exists, and they don't wear a mask. But we're not going to allow that to scare us from attending. But they are going to be shown virtually. So share it on your social media platforms.
So we will send out the link to those hearings. Jamie, this is on your to-do list. We're going to send out a link to those hearings. So join in, you know, so if they know that they have a lot of people who are then commenting in chats, this is, you know, so that they understand that there's a force behind it. So thank you both very much. Let's go to our final slides. So now you're understanding, this was why we wanted to close Women's Her Story Month with this great assault on women, this great understanding of what's going on with women's health in the state. You know, we've mentioned this one before. Through the generosity of 2 donors, we're having a 2-for-1 match on new donations. This is the last day of the match, and we're at 8,500 or so. We need another $1,500. If we can find people to donate $1,500, we'll bring in $4,500 through our match program. So this is very important so that we get out there early with money for candidates. We want to be able to support candidates in their re-elections early, and we want to be able to start supporting candidates as early in 2022 as we can. Check out our website. You know, I've advertised this. We're going to have, we put together videos of all of our events, and this one will be available. Share it with your friends. Even if they're not going to watch it, at least they know that this is something you're watching, you care about, and it is so important. Volunteer with us. Send us notes on what future breakfast briefings you want to have. By the way, should they all be breakfast briefings? You know, we kind of like that as our moniker for the what we do. But I've had a few comments lately that we're being discriminatory against mothers who have children to get off to school. So we're trying to figure out if there's other opportunities to do things at different times of the day that would bring in more people and more discussion. So, you know, we're open to your ideas. What subject do you think would be of interest to you and your friends that you'd say, hey, we're working on this. You are working on this. You think we should do an event on it? and it will enable you to invite more people to these calls. Future briefings, April 16th, we're going to talk about the State Government Committee with Margot Davidson, and we're also going to talk about what's going on with election laws. How did we get into the mess we're in Pennsylvania? A few other things that didn't make it to the slide. At the end of April, it'll probably be a noon meeting, but Congresswoman Madeleine Dean will be on with us. Many of you know that I always talk about the fact that Madeleine, when she was a state rep, was told to sit down and be quiet her first couple terms in the state legislature until she kind of found her way. Madeleine Dean is a congresswoman who was member of the, she's a member of the Judiciary Committee in Congress, and she was one of the impeachment people. Nobody in the US Congress is telling Madeleine to sit back. You know, this is her second term. No one's telling Madeleine to sit back there. And what we love about people like Morgan Cephas is that they're not sitting back and they're not being quiet, and we have to support them. And Madeleine will talk about that. I'm also working on another one on how did water get to be a political issue? How did we decide that, you know, what's going on, and having clean water is a political issue? Why is that not a right that we all have? And so that's another briefing we're going to do. And finally, in early May, we're going to try something in the age of pandemic. We're going to try and have an in-person meeting in early May that Senator Lindsey Williams, who's from Allegheny County, happens to be in Philadelphia in early May. And we're going to invite members of our endorsement committee who can attend that meeting in the Philadelphia area to come, and if they choose, we're going to have an outdoor breakfast session with Senator Williams. So a lot of things going on. We're trying to meet your needs, but come and join us and be part of the movement. You know, Morgan mentioned this before the call, the big issue facing Pennsylvania. There's a lot of money coming into Pennsylvania. Morgan is part of the Appropriations Committee. How is this going to be allocated? You know, you can say, well, you know, we're just going to plug some budget, but the budget was based on old assumptions. What do we want to do? That's one of the fascinating things about watching Joe Biden, is him willing to go beyond what was in the budget before and reimagine what the role of the federal government is. We're relying on Morgan and other members of the Appropriations Committee to help us reimagine what we want out of the PA legislature. And we'll go from there. So, thank you very much. It's been another lovely conversation. I so appreciate our special guests, and we'll be back at you. Take care.